Hello and welcome to the Psychic Stories podcast, encouraging conversations about mental health. Today I'm speaking to Sam Coles. Hello, Sam.
Hello.
How are you?
I'm well. How are you?
Good, thank you.
Good.
So the goal of this podcast is to have an open and honest conversation about your mental health journey, to get some insight into the tools and techniques that have helped you and are available and accessible to other people. And by discussing your journey, we hope to share and normalise conversations about mental health, as often people are not alone in these experiences. Does that sound okay with you?
Yeah, sounds good.
Awesome. So over to you. Please tell us about your mental health journey.
Okay. So I suppose my mental health journey has run parallel with my physical health, because about 3 or 4 years ago, I was diagnosed with Ankylosing Spondylitis, which is it's a rheumatoid arthritis, which is mostly it's inflammation in the spine. It's kind of focused in the celiac joint, which is right at the base of the spine, but it can go into other areas. Like I also have it in my knees and my rib cage. And I suppose I've always had quite severe back pain, pretty much since I was teenager, early 20s, without giving my age away. And you know, it took a long time before I was diagnosed, because I kept sort of I was going to the doctor a lot, and they were saying back pain is very common. And yeah, it took quite a long time before I was actually diagnosed with AS. And it's funny because I think that as soon as I was diagnosed, I felt like my mental health just went right down. I really struggled to think, like, how am I going to live with this thing? You know, I'm relatively young, and it's just going to get worse. And how am I going to live my life like this? How can I be in this much pain every single day?
It's a lot to cope with.
Yeah, and you know, I felt like I was missing out on not trying to be somebody that didn't have this illness. Was really exhausting. Trying to ignore it, trying to act like I was okay all the time, and so yeah, it was really tough to sort of wrap my head around that.
And that's when you got the diagnosis. So prior to that, from your teenage years, you just thought it was, you had no idea, but you thought it might be some back pain or something. But as soon as you got that definitive, and was it also that the nature of the condition, like you said, it is progressive. So am I right in thinking you can cope with it, but it will never get better? Yeah.
And it's unbelievably daunting to be told you have this thing, there is no cure. There are some things we can do, but not a lot. And it's just, it was such a strange feeling, because for so long I was trying to figure out what was wrong. And, you know, I had physiotherapy because they thought I had a slipped disc. They thought something was trapped on a nerve or something. And this went on and on and on. And I felt like it was so frustrating to not get a clear answer about what was wrong with me. And then when I had it, I was like, oh, can it be something else? Something that can be fixed with, you know, I don't know, some antibiotics or an operation or something. So I don't, you know, and I did what most people do in that situation. I Googled, you know, ankylosing spondylitis, and Google shows you the worst.
It's
case
not
scenario.
very helpful, is it?
No, it's not. Dr. Google is not a good doctor. And yeah, and it was really, really tough. And I didn't know how it was going to affect my relationship, my friendships. I felt a lot of I could tell that a lot of people felt, you know, I was getting a lot of pity from people who were close to me, which was really lovely. And I know that their heart's in the right place, but I was finding it was all just very overwhelming. And I just didn't want to have it, and I didn't want to admit that this is what's going on. And I didn't want to, I just thought, oh, I can manage this. It's not real. It's not really happening. And I feel like because I was trying so hard to ignore it, that it was sort of all come crashing down every now and then. Usually when I was having quite a bad flare up, and I was, you know, because I would struggle to walk, I couldn't dress myself very well. It wasn't just a sort of small pain. It was pretty much, you know, I was out for the
full
count.
body.
Yeah,
and needing other support, for example, like you said, to help get dressed. And
so my boyfriend, who I live with, he would, you know, he's a very, very patient man, and he he'd have to help me get dressed, he'd have to help me wash my hair, and so a big part of that was that you know, I felt so dependent on other people, which was really hard as well, because and I just kept thinking it'll get worse, and it was getting bigger and bigger in my head, and it was really, really hard to deal with. And I feel like when I first got diagnosed as well, and I was telling people, that a lot of people were really supportive to a certain point, and then it's like I think that because it is a chronic illness, that people forget, which is, you know, that's normal, that's, you know, that's life, that everyone is more focused on their own shit than they are everyone else's. But it would just be little things that, you know, I'd be out with friends and I'd be thinking, oh, I'm not sure if I can walk up those stairs, and things like that. I know that people would forget, and I'd have to sort of quietly say to somebody, oh, can I hold on to you while we walk up the stairs, because I need a bit of help. You know, and then people, oh, I forgot about that. Yeah, I don't forget.
And this is when you're in your kind of early to mid 20s as well, when you're going out, and also as well, like, you know, from knowing you also, you know, you love exercise, you love the gym, and that, you know, that diagnosis and the way that you change your life, that must have affected pretty much all of your life every day.
Yeah, and it was especially with the exercise thing, because that's probably one of the main things that I've always used to help if I'm stressed, if I'm anxious, if I'm feeling, you know, pretty low. If I'll do anything, even, you know, just like a walk. I just think moving yourself in any way that feels good, it does, well, for me, definitely, it improves my mood, it improves my mental health. The routine of it really helps as well. And when I was given this diagnosis, again, I was thinking, well, that's my main coping mechanism, and it's been taken away. So how am I going to cope with this awful thing when it impacts the thing that I used to cope? Exercise actually is very, very beneficial for for all types of inflammatory arthritis. So if anything, it gives me a bit of an extra push, because sometimes if I'm feeling really like sort of having a rough patch and I'm finding it hard, and I just think, oh, I don't want to get out of bed, I'm in so much pain, then I think, oh well, if you just walk you know, get out of bed and take a couple of steps, that will be that will kind of help. And the longer that you don't move, the worse it will get. So it's almost like I've tried to look at it as like almost a positive thing, that some days when I'm thinking, oh, I can't be bothered doing anything, I'm going to stay in bed, I'm going to eat pizza, I'm going to watch Netflix, I think I'll pay for this tomorrow because I won't be able to move. So it's like, no, come on, get up, put your trainers on, go outside.
And is it something that you can feel? So, for example, when you do the exercise, is it painful to start off with, but then does it immediately start to help, or is it something that will just be helpful, let's say, like you said, the next day?
It depends. Sometimes I've been biting back tears because it's been so painful for the first 5 minutes, and then fine. I mean, I've crawled to the gym at some points, and then walked out completely fine, as if I'm, you know, don't have anything wrong. And other times it has been too bad, and I've, you know, said this I can't carry on anymore, so I'm just going to stop and go and rest instead. So it's taken me quite a long time to kind of figure out what's right in my body, because a lot of the time I'd push through the pain, and then sometimes that would work like a charm, and other times I'd be bedridden for 2 days. So it's a lot of trial and error. and like I said, I've been diagnosed this for a couple of years now. I do take biologic injections, which hugely help, but there's another added element with that, in that because these biologics, they suppress your immune system, so it's quite a scary thing to know that you're actively suppressing your immune system, because you're obviously at high risk of picking things up.
Which I suppose at the moment, like,
yeah,
that must have added a huge extra weight of anxiety as well.
Yeah, it did, and yeah, and it's quite hard to you forget sometimes that you are immunocompromised, because it's not something that you are aware of.
You can't feel it, can you?
Yeah, exactly. And yeah, and they, again, like, even though they've been so helpful, like, they have really they changed my life pretty much. They do have quite bad side effects, and for me, it was a lot of weight gain. I felt I've always kind of struggled with anxiety, and I felt it getting a lot worse while I was on them, which is quite, well, a fairly common side effect, as I understand. So even though they've helped me with my mobility, there's been a lot of other setbacks, and sometimes I can think, well, why can't, like, why me, and all that. But
so how do you, so like you said, if the exercise is not taken away with you but is restricted in terms of your coping, like, how have you found, like, have you found new ways to cope?
I wouldn't say I've found. I would always go to the gym, and when I couldn't, I'd have to reassess and my way of, like, getting rid of my stress and my pent upness would be sort of like very high impact training, heavy weight training, which those two things I just can't do anymore. And so I had to hugely adjust what it is I actually do, because I just couldn't do those things. And yeah, and I guess that sometimes I used to I suppose I'd got a little bit obsessive about having to do this routine of, I have to do this, I have to do a certain amount of time in the gym, I have to do a certain amount of reps, all that. Yeah. And now, I don't know, I feel like because I have to kind of rethink about how I'm doing it, it's made me feel like it's not about trying to beat a personal best or anything. It's just about moving my body in a way that feels comfortable, in a way that feels good, and that will hopefully make me feel better.
And actually, that sounds like a kind of like a smarter way to train and exercise, like to work out how you feel on the day, and to adapt in terms of the exercises you're doing, or how you're feeling, and if you've got more energy or less energy. And that doesn't necessarily need to apply to, let's say, for like yourself, which is you need to adapt, you have to adapt. But actually for anyone as well, you don't need to stick to these routines, you don't need to do X, Y, and Z. You can as long as you're there and you're working as hard as you can in whatever way you're doing it, doesn't matter if it's small or large, it's serving its purpose.
Yeah, exactly. And it's more enjoyable as well.
That's a good point.
I wasn't putting the pressure on myself or anything. I was just doing it because it's something I enjoy. And yeah, and I suppose kind of in that vein, I also had a double mastectomy I think it might be 6 months today. 6 months tomorrow. I had a double mastectomy. Yeah, and that hugely impacted the way that I was able to move. I mean, I couldn't move my arms for, I'd say, a good 6-7 weeks. So again, I had, my parents and my boyfriend did everything for me. I was like this the whole time, so I couldn't do anything.
And just to put it into context, your double mastectomy was it related to your, like you said, your arthritis, or is that something completely separate?
It's completely separate. It is, I've got the BRCA2 gene mutation, which means that I was at a very increased risk of breast cancer. I think it's, if you have the gene mutation, I can't remember the exact percentage, but it's I think it's between 60 and 85%, which is
incredibly high.
Incredibly high. I mean, the way that I had a fantastic surgeon, and you know, the NHS is just incredible. The amount of support that they offered for my whole experience was just, it was unbelievable. You know, I had a lot of consultations with a lot of different people, and one thing that always stuck with me is one of the many people I spoke to sort of said, if somebody says to you there's a 60 to 85% chance of rain, you're taking your umbrella. And I thought, yeah. So it wasn't an easy decision in terms of whether or not I was going to do it, because I always knew that I would. And my family history is, my mum had breast cancer when I think she was diagnosed when I was about, just in high school, it's about 15 or 16. And she had treatment, and then she was tested for the gene mutation, found out she had it. So she had a double mastectomy. I'm not actually sure if it was in that order, because it was quite a while ago. And during that time as well, my auntie had breast cancer, and she had it once, and then it came back, and she passed away. I think again, I think about 17 or 18. So it was really close. I can always remember it was really sort of close together. It was almost, you know, it was yeah, it was really, and
I'm so sorry to hear that.
Oh, thanks. Yeah, it was not a good time,
but
yes,
like, from what you were saying, you know, two people in your family, your mum and your auntie, like I was doing some research before, and 1 in 7 women will get breast cancer. That's you know, in the UK. That's an enormous percentage, and like you said, when you've got this gene, that increases your odds to 60 to 85%, which is, and from my research, it's the leading cause of death for women under 50 in the UK. I mean, it's incredibly prevalent.
Yeah, and in terms of the age thing as well, my mum and my aunt, I think they both had it before they were 40. So which isn't as common. It does happen, but it's not quite as common. So when I turned 30, it was almost like I felt like it was like tick tock.
Yeah.
And when I was, so my mum's kind of always sort of said to me, you should get tested for this gene, because it's you know, there's a fair possibility. So the fact that I had the gene wasn't a shock. I mean, I remember I went in, it's just a simple blood test to have the test. And again, this is all on the NHS. I think if you have a strong history of breast cancer in your family and people have the gene mutation, then you can be tested. Yeah, and they said when you get the results, you can come in and speak with a counsellor. And I just said no, just send me a letter, because I said to them, I'm almost positive that I will have this gene, so don't, I'm prepared, so just send me a letter. And then I can remember when I got the letter and I was like, oh my god, I do actually have it.
And this was on top of the arthritis.
Yeah, and it was kind of like, I almost felt like I was slowly getting my head around the arthritis thing, and then that happened and I was like, oh. And
that's an enormous amount to process, at your age, let's be honest. And it's a huge amount to try and take on and cope with.
Yeah.
That's okay. But I think like you were saying, and I think the question is how did you, what was the process? How did you cope from because it's a huge thing to deal with.
Yeah. Well, it's quite weird because I always think of these two things, like I said, they're like these two constant things in my life that will always be a part of me, and they are so intertwined with my mental health. And it's weird because the arthritis is like this kind of, I don't want to say a low level, but it's a constant thing that I'm dealing with, and sometimes it's worse and sometimes Sometimes it's worse and sometimes it's better, but it's always there. Whereas the mastectomy was like a huge thing that was very sort of compacted, and it was sort of like two very different things to deal with. And again, like the NHS were just brilliant. I had counselling. I don't know if that's the correct word, but I saw
you had some talking therapy of some kind.
Yeah. And you have to have this a few sessions, I think, to make sure that they understand that as a patient you understand what it is that happens to you, because I know that some people think, oh, it's a boob job on the NHS, but it's not. It's almost like saying, oh, don't bother getting hair extensions, just shave your head and wear a wig. Like but I think because I saw my mum go through it, and I knew, I feel like from the start I always kind of had a good understanding of what a big thing it was going to be. But I can't, the counselling sessions I had were just, I was very skeptical, because I didn't think it would do anything. I thought, how can talking to somebody about all this do anything? And I sort of would go in there and I'd sort of say the things I thought I was supposed to say, and not really, I was given a couple of exercises that I would try and do, and I used to just think, this isn't me. And then I think it was when I got the date for my surgery, and I had a therapy session quite soon after I'd got the date, and I went in, I think I just cried for 2 hours. And I just had it, I sort of stopped pretending like, oh, it's fine, oh, I knew I'd have it, oh, it's not a big deal. And I sort of just said, yeah, no, it's a really big deal, and I'm not coping well with it. And it was weird, because one of almost when I admitted that I'm not coping, I can't deal with all this, it all got so much easier, because it was like I was holding it in and trying to act like I was okay. And I suppose for myself, for the people around me who were worried, I was just trying to be like, this is fine. And then as soon as I let it go, I was like,
and there's a very distinct feeling when you let it go, doesn't it? It almost feels like your mind, like you said, is not clenching anymore. You let that issue go, and the issue's still there, but you're able to, I don't know, it doesn't affect you as much anymore. It's a strange feeling.
Yeah. And one of the, I'm quite a visual person, and one of the best bits of advice that I had from my therapist, who was just wonderful, is that he said, picture that you're on holiday, you're in a swimming pool, and you're holding like an inflatable ball. And in my head, I always pictured, those inflatable drinks holders that you can get now? Well, when I went on holiday with my friends, and I got a pink flamingo inflatable drinks holder. So in my head, it's a pink flamingo inflatable drink holder. And he said, if you're holding your pink flamingo, and you're trying to push it under the water in the swimming pool, you're using all your energy and all your effort to try and keep it under water, when if you just let go, it would just bob around, and you're able to get on with things and have a nice time on your holiday. You can have a drink, you can have a selfie with your friends, you can do whatever you want to do. Whereas if you're holding it all the time, you can't do anything else, because you're just holding it.
It's a really good visualization.
Yeah. And he said, and sometimes when you're swimming in the pool, your flamingo is going to bob back over, and it might knock into you, and you're going to be annoyed that it's come back again, and you're thinking, oh, I thought I had got rid of you, why have you come back? And it was just like something clicked in my head, and I thought, that's what it's like. I feel like, me personally, I've always thought, okay, I'm feeling really anxious today, my heart's beating really fast, I've got butterflies and I don't know why, I feel really irritable and really wound up and I don't know why, and I have to do something about it, I have to get rid of it, I have to not have it anymore. Whereas that's not that's not the case. You have to just acknowledge that, well, for me, it's like, okay, I'm feeling this way, but why am I feeling this way? Maybe I just need to let myself feel that way for a little while and let it pass. Or if it doesn't pass, just know that it will eventually pass. Whereas, I don't know, a couple of years ago, when I was feeling really low or anxious or anything, I'd think I'm going to feel this way forever. This is me forever. This is something that is just going to be terrible forever. And yeah, and it that one analogy of the flamingo really, yeah, it felt like a puzzle clicking together in my brain, because
also did it help, like, you're a very humorous person.
Cheers.
Did it help it being, that red flamingo from Marbella, for example? Was it helpful just for it to be quite funny, and just to say, actually, hold on, like, this is something which I can, not necessarily, it's very serious, but I can still laugh at it, and in some situations.
Yeah, and it made it seem like something really like frivolous, which I'm not saying that, like, mental health is, I'm not, that's not what I'm trying to equate them, but it made it seem like something much less scary, and much less, it felt like something I could deal with. Like, it's like, oh, this pink flamingo, like, oh yeah, I can deal with that. Whereas when you talk about
I've seen a lot of them.
Yeah, but when it's something, and I think as well that because mental health obviously isn't a tangible thing, it feels really hard to do something with, because you can't see it, you can't hold it, you can't touch it. It's just a feeling. It's just, it's all internal. Whereas for me, picturing it as an actual thing that I was holding and had to let go of, I was like, oh, yeah, that's what I can do.
And you have power over what object you visualize, isn't it? So that, it's a very, that approach is very personalized for everyone. How would you say to someone else, how would you interpret that, and not advise them, but kind of say, look, this are the tips that I use. Pick something funny or something that you can relate to, make it seem much smaller so that you can deal with and cope with it.
I suppose it depends on what type of person, because he did give me another visualization thing, where it was a guided meditation, which I've always been awful at meditation. I tried my absolute best, because I know that a lot of people just swear by it, but I'd get frustrated for myself because I couldn't do it, and I couldn't switch my brain off. And I know that's the reason why you do it, but I was getting more and more annoyed that I couldn't. But we did a session, and he was saying about you're next to a stream and there's leaves floating by in the stream, and he was saying that these are your worries, and you're putting them in the leaves and they float away down the stream. So I don't know, I think for me it's visualizing something that seems so frazzled in your brain and so hard to pick out and break down it. And especially with the lead up to my surgery, it was sort of, I was just so worried about so many things, but when I was picking it apart, it seemed like much more manageable. Like, so, oh, I'm not gonna be able to move my arms, I'm not gonna be able to do anything, oh my god, I'm gonna put on even more weight, and I'm not gonna be able to do any exercise, and all that spiraled something in my head. And then I thought, well, no, just scale it back, and you can do very, very small things. And the one thing that I know that I do as a sort of coping mechanism is to have some control over things that seem really out of my control. So back to after my surgery, I knew that I wouldn't be able to move my arms, so I spent a day in my flat basically moving everything out of any top shelf so that I would be able to reach things at all time. And I thought, this is a present from past Sam to future Sam, and future Sam will appreciate this when she can't do anything.
So, and there's an element there of being kind to your future self, right?
And and just yeah, I suppose like just thinking about what things that I can control and what things I can't. So I couldn't control the fact that I couldn't move my arms. Like that was just, that happened, and that I was told that would happen. It wasn't actually wasn't as bad as I thought it would be. And after about 4 weeks, I was able to lift my arm up in the air. And I went in to see the surgeon and I told him this fantastic news, and he was like, but you're not supposed to because it can do something to the implant or something. I was like, oops.
So you went in, almost trying to impress him.
Yeah.
Look,
yeah.
I can do this.
Teacher's pet. But he was like, please don't do that anymore. I was like, no, okay. Yeah, and I suppose back to just what when I was speaking to the therapist, is that one really weird thing that kind of I always remember about that period, because the build up to the surgery was far worse than the actual surgery.
Yeah.
Far worse. I mean, the surgery, I don't know because I was asleep. And the recovery was tough, but because it was a physical pain that I had and a thing that I had to work towards getting over, I just felt like I could deal with it. Don't get me wrong, I had a fair few wobbles, because like sometimes I'd look in the mirror and I'd be like, I've got these big old scars, and I was very swollen, I was very bruised. I didn't know. It was really hard to look at myself because I just didn't know who. It just didn't feel like me, and it was very hard as well.
Of you, isn't it?
Yeah, exactly. And it was it just took a lot of adjusting. So I did struggle with it, but nowhere near as bad as before the surgery. And I think I always think if I could have just told myself before, like, you will get through this and you will be okay. But I know hindsight is a wonderful thing. But yeah, it was weird because, yeah, this might sound a bit morbid, but in the lead up to it, especially until like the week before, when I had, a lot of people were just fantastic, like really rallying around me and just being so amazing, and it meant so much to me. But at the same time, it was always in the back of my head, like, you still have to do it. So you're still the one that is going to go through this, and you will go through it alone, because even though I'd physically have people near me, and especially my mum, who had, is able to empathize a lot more than other people, because she she understands it, because been through worse herself. But I just kept thinking, like, no one can do it for me, I have to do it myself. And that's something that I try to apply to other things when I find them challenging, and that no one can do this for me. Like, yeah, I'll find it hard, but I will get through it, just like I got through that. And like, what is the worst that could happen? I mean this in like very small things, like trying something in work that might not come off, or and I think, well, what's the worst that could happen? Whereas I think a couple of years ago I used to wind myself up, and would maybe make things a bigger problem than they probably were.
So now, do you actively and consciously try and put things in perspective, which is a very hard thing to do, especially when you're in that environment?
It is really hard. And I think that, I think my mental health was much, much worse before I had this operation. I feel like it was a really big thing that was really hard to deal with, but it's taught me a lot of things that I've been able to apply to other areas of my life. And like I said, it's strange with the arthritis, because that is, again, a very challenging thing, but in a completely different way. And I still have my bad days where I think, why me? Why did I have to have this stupid thing? And and then I just let myself have that, you know.
Yeah.
I just think, well, yeah, it is crap, but tomorrow won't be as crap, and maybe next week you'll have another crap day, but you won't have a crap life.
Exactly, yeah. And yeah, does that motivate you to? Does it motivate you to think actually like that there are sporadic days which are really bad, but does it say, okay, well, actually, well, how can I make this this day a little bit better? What can I do to kind of to try and boost my mental health, make myself feel good?
Yeah. For me, the biggest thing that I've learned is letting it be bad for a while. And I feel like if I had, again, before the operation, if I was stressed, I'd be like this. And then my back pain would get a lot worse because I'm very tense.
Yeah.
And then I'd be stressed about how my back is bad or getting worse because I'm stressed, and I'm stressed because of something else. And now I'm stressed about my back as well. And I would try really, really hard to not be stressed and to not be whatever. Whereas now, I almost just let it happen and let myself feel anxious, stressed, depressed, whatever.
Because those are natural feelings. It's not like we can just push those away. It's like, no, but being anxious or being stressed, it tells you something, and you can't just deny those feelings. You listen to them and accept them, that okay, there's stuff going on that I need to perhaps just think about and just observe and watch.
Yeah, exactly. And it's trying to act like it's not happening. For me, it would go on for days and days and days and days. I'd be feeling really stressed and really wound up, and I had no release for a long time. Whereas now, if I'm feeling a bit like that, I just think, oh, I'm gonna go and have a lie down, and I'm gonna have a cup of tea and just lie down by myself. I don't want to talk to anybody, and I feel like I would get over it far quicker than I used to, because I'm allowing myself to feel a bit rubbish, excuse me, for a few hours, instead of trying to, I don't know, put on a face. And
so and in some respects, is that, I mean, it sounds like you're being more kind to yourself. I know we've said that before, but you're kind of saying, do you know what, Sam, it's okay to feel this. You've got a lot going on. Like, just make yourself a cup of tea and go relax for 15-20 minutes, see how you feel.
Yeah, and funnily enough, it was something that the therapist, but for the breast care therapist that I had, he said, "Oh, you're really hard on yourself." And I was like, "Oh, but I think everyone is." And he was like, "But you're going through a very big thing, and you have another big thing that will still be going on, throughout that." Because that was another kind of another thing that I was worrying about, because I couldn't have the arthritis injections in the lead up to the surgery.
God,
I couldn't have stressful. Them. Yeah, because then I was thinking, I'm not going to be able to move. Whereas, and my arthritis is going to get much worse because I can't move. It was all fine. Morphine is a hell of a drug.
But in order to cope for that, did you use morphine as a painkiller to suppress the pain, so you were able to cope in that respect?
Yeah, I mean, I was, that was when I was in hospital, because I was in hospital for a week. So, and they give you painkillers around the clock and morphine. And a funny thing happened, that I was discharged from hospital. I was given some antibiotics to take and was told to keep taking painkillers. I kept waiting for my back to rear its ugly head, and it just didn't. Like, it felt fine, and I was probably the most I just didn't move because I couldn't for the longest time, and I kept thinking it's going to get so bad because I'm not moving. And I actually think it's because when I came out the other side of it, I was like, and because I wasn't holding all this stress, that my bones were okay for a while. And I actually had a extended period where I wasn't taking the biologic injections, partially because that was when lockdown. And I was thinking, oh well, I've had a couple of months without taking them, and it's been okay, so I'm gonna carry on so that I'm not completely immunosuppressed. and it was fine. I've gone back on them now because it started creeping back in again. And again, I think in the past I'd spiral with that. I'd think, oh my God, it's come back. This is the worst thing ever, and it's going to be bad forever. Don't get me wrong, it came back terribly in my knees, and it's quite frustrating when it comes in places where I haven't struggled with it too much in the past, because I think this is another new area in my body that is not working properly. Whereas usually I'd try to ignore it, try to hold the flamingo and push it under and pretend it's not happening. Whereas I was just like, this is shit. This really hurts. I can't walk properly. So I ran my rheumatologist and went back on the injections, and
it helped.
Yeah, really helped. And I thought usually I'd let it get so much worse before I asked for help, but I just thought, this isn't a way to live, so I'm going to ask for the help.
And do you find that the experience you had with your mastectomies, and the talking therapy and the visualizations, the kind of the tools that you gained from that, have helped you deal with the arthritis in a more productive way now?
Oh yeah, 100%. And I feel like the biggest thing that apart from the visualization, but the fact that it just felt so okay to not be okay, and I just felt like it was really fine to be like, I'm struggling. And a weird thing that I have kind of thought about, and this has been on my mind, I knew that we were speaking, and is that when I was first diagnosed with the Ankylosing Spondylitis, I went on antidepressants, and the GP that I spoke to did say to me, do you feel like you needed these before, or do you feel like you just need them because of this diagnosis? And I said, I think I did need them before, but I didn't feel like I should, because I almost felt like when I had an excuse, that I went in and I asked for the help, because I felt like I could pinpoint it on something. So in some ways, I think people who are struggling and don't know why, and don't know, that they can't attribute their mental health problems to a physical health problem. And I think that is just so much harder, because you don't feel like you want to ask for help. Maybe I certainly didn't. I felt like, oh, I can deal with this by myself. And then it was almost, when I was diagnosed with something bigger, a physical thing that was documented,
it enabled you to go, okay, I can have help now.
And I think it was interesting to me that the GP I asked, and I did say, I think I needed these before, and I just didn't want to ask, and I don't know why, because
and you mentioned, like you said, like you wanted to do it yourself. Was it a pride thing? Was it because we talk a lot about stigma of mental health? Was it a stigma? Was it or was it completely personal? You said, no, actually, no, I want to deal with this stuff on my own.
Well, I think that mental health I feel like it's become less of a taboo to talk about. I feel like people are a lot more open about it. I mean, like my friends and family, it's something that you talk about, but I still do think that while people talk about it more, it's such a different thing going into the doctor and saying, I need help, because I don't know what it is. Well, for me personally, I felt like there was a barrier, and it was like you couldn't ask for. I don't know what it was. It was like a lot of me have also thought that there's people who need it more, or other people have it a lot worse than I do. So I kind of can't ask for help with this, which isn't, it's pointless comparing yourself to somebody else, because everyone has their different experiences with things, and
also it's difficult to ask for help because often you ask for help with something, but if
Yeah,
you don't know what that something is,
yeah, exactly.
it's
Like,
very difficult. Like, well, what do you ask for?
yeah, and I felt like I could go in there, and even then it took me a very long time, but I could go in there and say, I was diagnosed with this chronic illness and I'm not struggling, I am struggling, and I don't know what to do, and I need something to help. And yeah, and I wonder if I ever would have done that. And again, you know, like, I sort of accidentally forgot to take, I was taking my antidepressants up until my mastectomy. I actually increased because I was, you know, I was very, very, very worried. You know, I'd never been in hospital for anything before. So I was, yeah. And while I was in hospital, I wasn't taking them because I just forgot. It was just so far from. I had them with me in my hospital bag, and you know, I think they were next to me on the table, but I just didn't take them because I didn't feel like I needed to, and I also felt like I was so full of drugs that it was just so far from my mind. And then I was discharged, and then I was then just thinking about the biologics for the arthritis, and I was more just thinking about those. And then it got to like 4 months, and I thought, I haven't taken them. And I think I wasn't on them for that long. I think a year, maybe 2 years. And I haven't taken them. I haven't gone back on them. I know that they're there if I need them, but I'm not. I feel like it was kind of a happy accident that I stopped taking them. Not that I think there's anything wrong with taking them at all. Like, I think anyone who thinks that they need them should definitely, you know, seek that help. But it was more that it was quite nice in a way to know that, okay, like, maybe I have gotten through it a bit, and I'm able to manage all the things that are going on by myself.
Yeah. Which is
And I suppose,
amazing, frankly.
oh, thanks.
But it is, it really is. And I think we were chatting just before we started about you saying that reaching out to a community helped.
Oh yeah, so I was a bit of a creep on Instagram, and I follow the Ankylosing Spondylitis hashtag and the BRCA2 hashtag, and there are so many very, very brave people who post about their journey with both things, and I follow them, and I would creepily message them.
Well, but it's not creepy. You're someone who's going through it.
Yeah.
And, you know, it's hi. I'm here. I'm struggling. I'd love to reach out and connect with you.
Yeah. And you know, no one ever responded as if like, who is this girl messaging me? People are always happy to have the shared experience because it makes you feel less alone. And yeah, especially, again, they're two very sort of different things, but with the arthritis, when I was first doing these biologic injections, because I do them myself once a fortnight in my leg. You can also do them in your tummy, but that's why I do them in my leg. And a couple of times I would post things about the injections, and you know, I'd get little tips from other people who were doing them. And I one tip that I had, because you have to keep these injections stored in the fridge, and when I used to inject, it used to sting, and it was horrible. You have to hold it in your leg for 10 seconds, and I'd be like grimacing because it was so painful, and it was really, really stings. And this woman said to me, oh, if you take it out of the fridge for 10 minutes, it's not as cold and it doesn't sting. And that changed my life. I could barely feel it then.
That tiny little tip.
Yeah, tiny little tip. And it was almost like I could do the injection, like, you know, I wouldn't even sort of flinch. I'd do it while I was like chatting with my boyfriend about our days. And it just completely changed everything. And again, when I injected once, and I spilt some of the liquid, and I put a picture of it on Instagram, and I was like, this is how much of the dose I've missed, is it okay? And I was just like inundated with advice, and and not just from the UK, it was people from all over. You know, some of them were in the US, and they were saying, "Oh, I've got a number for a nurse here, but it probably won't do anything for you there."
That's amazing.
But people want to help, and
very quickly, I imagine, as
yeah,
well.
oh,
As soon as
so
you
quickly.
post, you're talking seconds where people are.
Yeah, and you think, you know, if you call the nurse, you know, especially if it's like, I always do my injections kind of late in the evening, because then I can sleep off like the worst of the side effects. So I don't want to call a nurse at like 9:30, 10 o'clock at night. Are they even there? Is this their personal number? Like, who would I, what if I don't speak to the same nurse who doesn't know who I am and what medication I'm on? With, you know, Instagram, it's like instant.
It's such a powerful thing. We talk about, we think about Instagram of projecting our image of our own lives, of businesses marketing themselves, but actually there's a huge amount of help which can be gained from that, from millions of people who might be going through a very similar experience. Yeah,
and you know, I followed a few women who were having double mastectomies as well. One who, I think she had hers about 3 months before mine, and another woman who had hers the day before mine, and just like really specific advice, and really, like, one was helping me pack my hospital bag, and I've never ever met them in person. We only communicate on Instagram, and they were so valuable to my experience, because they just knew things that you wouldn't get from speaking to say the nurse or your surgeon, or like a leaflet that they give you. It's somebody who's having a real experience and is saying, "Oh my God, you make sure you bring this, because I really wished I had it the whole time I was in hospital." And it's the two women that I mentioned were braver than me, because they posted pictures of what they looked like after, and it don't get me wrong, it alarmed me, because I thought, it just looks painful, it looks swollen, there's a lot of bruising, and you can see the stitches and everything. But at the same time, I felt prepared, because I thought, okay, there's no second guessing someone putting something like that out there. And then when it happened to me, I was like, it's okay. I've seen this. You know, I know someone else that went through this, and I know that this is normal, and it's nothing to. I know it won't look like this forever. Whereas I think, sort of without that, I could have been a lot more worried. About how I was recovering, and you know, the sensations that I was feeling, and
if they were right or wrong, or
and I probably would have been calling the hospital every 2 seconds if I hadn't had sort of, you know, that support network. And it was sort of like going back to what I was saying about how I had a great deal of support, and I'll always be grateful to the many people who were, you know, by my side throughout the whole thing. But it was just such a different type of support network, having someone, or some people who were going through the exact same thing.
And they don't need to be friends, do they?
No, not at all.
They just need to have gone through
it. And I think, like, sometimes, I don't know, I think sometimes Instagram especially can get a bit of a bad rap, because, you know, people paint the most perfect version of their life, whereas, you know, I think if you look for it, there's so much more. There's people who are sharing very real things, and things that they might you know, that someone who might never get in touch with them ever might just see it and think it can provide some comfort to somebody who's struggling. You know, I know there's like a lot of mental health accounts. Like, I follow quite a few that a couple that do really beautiful illustrations about, and it's again, it's a very visual thing, and it's it just feels a bit more relatable, I suppose. It's not, you know, like reading it's
not clinical, it's not a hospital.
And
and do you so you've got those tips from the two women that you got from Instagram, like now for people listening who might be going through similar, like what tips would you give them, not in terms of the grand process, but those little things that you would have never been told? What was really useful for you?
A lot of it was really specific things about like what to pack in your hospital bag, so I don't know if that would be that much use, but one of the women who was really helpful, her name's Kristen, she messaged me and she was like, honestly, when you get through the other side you'll think, oh, that wasn't as bad as I thought it'd be. And she was like, I know it's really hard to visualize that, because she was like, I'm the other side of it, but you're the other side of it. And she said she was, the same as me. She was very worried about the before, but she said the after wasn't that bad. She said it was a couple of weeks of being in bed, which was boring and frustrating and a bit sad as well, because I suppose you're adjusting to your new body, and I suppose you feel a bit very strange, and it's just a really weird thing to think about. So that kind of always stuck with me, that she was like, it won't be as bad as your brain is telling you that it will be. She was like, you'll cope.
And you could accept that because it's someone who'd been through it. It wasn't just someone who was just going, no, you'll be absolutely fine. This is like, no, I've been through it. You are going to be okay. It is not as bad as you think right now.
Yeah. And, the fact that she said she wasn't sort of all rainbows and sunshine. She didn't say, oh, it'll be absolutely fine. Like you said, you'll get through this. And it was more like, it will be hard, but it will not be as hard as it is in your mind. That you will be able to deal with it. And I did.
And you did, and and like, I mean, God, thank you so much for your time and talking us through. You've been through a huge amount. Like, you are incredibly brave. You really are. You've got, and it's amazing to see your journey, because this has all happened in a relatively short period of time, in the matter of years, and to see what how you said you were like before to how you are like now, and being able to articulate that and talking about the tools and the tips and that have helped you so intensely, but also so quickly. It's frankly amazing. So, Sam, thank you so much for a fascinating and insightful conversation.
Thank you.
And thank you to everyone listening. You can subscribe to us on most major podcast platforms: YouTube, Spotify, Apple Podcast. Just search for Sidekick Community or Psychic Stories and we'll pop up. Sam, thanks so much again.
Thank you.